Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Serenitha. I'm Dr. Oliver. How are you feeling today?
Hi, Dr. Oliver. I'm not feeling too good. I've been experiencing pain in my lower back and left hip, and it's becoming difficult to walk.
I see. Can you tell me your full name and age, please?
My name is Serenitha Morgenstern, and I'm 24 years old.
Thank you. Can you tell me your address and the type of residence you live in?
Sure, I live at 26 Cherry Tree Lane, Winchester, Hampshire, UK. It's a single-story house.
Thank you. Can you also tell me about your closest relatives? Do you have any adults in your family, and what do they do for a living?
Yes, my mother is Isadora Morgenstern and she's a chef, while my father Lucien Morgenstern is a lawyer.
Thank you. Any other family members, like siblings or children?
No, it's just me.
Okay. What brought you to the hospital today?
I mentioned earlier that I've been experiencing pain in my lower back and left hip, and it's been getting worse. I'm also having difficulty walking, and my left leg feels weak.
I understand. Do you have any past medical history that you can tell me about?
No, I've never had any serious health issues before.
Okay. Can you tell me if there are any illnesses that run in your family, like heart disease or diabetes?
My father has hypertension, and my mother has asthma.
Thank you. Can you tell me a little bit about your social history, like your job or hobbies?
I'm a college student studying biology. I'm not working at the moment, but I do enjoy hiking and reading.
Okay. Do you smoke or drink alcohol?
No, I don't smoke and I only drink occasionally with friends.
Have you ever used any recreational drugs?
No, I haven't.
Do you have any allergies to medication or food that I should know about?
No, I don't have any allergies.
Can you tell me about your dietary habits?
Yes, I follow a vegan diet.
Thank you. Are you currently taking any medication or supplements?
No, I'm not taking anything at the moment.
Okay. I'm going to take your vital signs now. Your blood pressure is 120 over 80 millimeters of mercury. Your heart rate is 85 beats per minute, your respiratory rate is 16 breaths per minute, and your temperature is 37.1 degrees Celsius.
Okay.
Based on your symptoms and the imaging studies we've done, I suspect that you may have rhabdomyosarcoma, a rare cancer that develops from skeletal muscle cells. We will need to do further investigations to confirm the diagnosis. I will order some blood tests, a biopsy of the affected area, and a CT scan to see if the cancer has spread. Are you familiar with rhabdomyosarcoma?
No, I've never heard of it before.
It's a rare form of cancer that affects the skeletal muscle cells. We will need to start treatment as soon as possible to stop the cancer from spreading. We will be giving you a combination of chemotherapy and radiation therapy. Do you have any questions or concerns about the treatment?
Yes, I'm a bit worried about the side effects of the treatment.
It's understandable to be worried. The treatment can cause some side effects, but we will be monitoring you closely and managing any symptoms you experience. I'll prescribe some medications to help with any pain or nausea you may feel. In the meantime, we'll start you on analgesics to reduce your pain and keep you comfortable. We will also have a team of nurses and other healthcare professionals to help you with your care. We will provide you with all the necessary information about the medications you will be taking, the dosages, and how to manage any side effects. Once we confirm the diagnosis, we'll give you a more detailed plan of your treatment and discharge.
Okay, thank you, doctor.
You're welcome. We'll be with you every step of the way. Is there anything else you'd like to know or share with me about your health?
No, I think that's it for now.
All right. I'll be in touch with you once we have the results of the investigations. In the meantime, please let us know if you experience any changes in your condition or any new symptoms.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. My name is Dr. Jones. Can you tell me your name, please?
Hi, I'm Valentina Rossi.
Great. And how old are you, Valentina?
I'm 62 years old.
And what is your address?
I live at 23 Oak Street, Melbourne, Victoria, Australia.
Can you tell me what type of residence you have and what area it's in?
I live in a detached house in a suburban area.
Do you have any close relatives we should be aware of?
Yes, I have my husband, Mario Rossi, who is 65 and a retired construction worker, and my daughter, Lucia Rossi, who is 38 and a nurse.
Thank you for that information. Now, can you tell me why you're presenting to the hospital today?
I have a painful rash on the left side of my abdomen and back, along with a fever and fatigue.
I see. Before we proceed, I need to ask you some questions about your past medical history. Do you have any pre-existing medical conditions we should be aware of?
Yes, I have hypertension, hyperlipidemia, arthritis, and chronic kidney disease stage 2.
Thank you for that information. Is there any history of illness in your family?
My mother had a history of breast cancer.
All right, let's move on to your social history. Do you work, Valentina?
No, I'm retired. I enjoy gardening and cooking.
That's great to hear. Can you tell me about your drinking and smoking habits, or if you have any recreational drug use?
I don't drink or smoke, and I don't use any recreational drugs.
That's good to hear. Do you have any allergies we should be aware of?
No, I don't have any known allergies.
Can you tell me about your dietary habits?
I follow a low-sodium, low-fat diet, as recommended by my physician.
And what medications are you currently taking, including their dosages?
I take amlodipine 10 mg daily for my hypertension, atorvastatin 40 mg daily for my hyperlipidemia, and naproxen 500 milligrams twice a day as needed for my arthritis pain.
Thank you for that information, Valentina. Now, I'd like to take your vital signs, including your blood pressure, pulse, respiratory rate, and temperature. Based on your symptoms and vital signs, I suspect that you have shingles, a viral infection caused by the varicella-zoster virus. I'd like to perform some investigations to confirm this, such as a viral culture and PCR testing on a sample of your rash.
Oh, I've heard of shingles before. That sounds like it could be it.
Yes, it's a common infection that can be quite uncomfortable. If it is shingles, we'll need to put you on contact and airborne precautions due to its contagious nature. We'll also need to start you on antiviral medication, such as acyclovir 800 milligrams 5 times a day for 7 days, and pain management medication, such as acetaminophen 650 milligrams every 4 to 6 hours as needed. We'll monitor your vital signs regularly and make sure you stay hydrated and well-nourished.
Okay, I understand.
We'll also need to follow up with your primary care physician in a week to make sure you're healing properly. Is there anything else you'd like to ask or discuss, Valentina?
No, I think that covers everything. Thank you.
Great. Before we proceed, I need to inform you that shingles can be quite contagious, especially if you're in close contact with people who have not had chickenpox or the varicella vaccine. Therefore, it's important to avoid close contact with others until the rash has healed completely.
I understand.
Also, I'd like to inform you that shingles. If you experience any ongoing pain or discomfort after the rash has resolved, please let us know.
Okay, I will.
We will be providing you with antiviral medication and pain management medication, such as acetaminophen, and we'll monitor your vital signs regularly to make sure you're responding to the treatment. We'll also make sure you stay hydrated and well-nourished.
Sounds good.
Before you leave, we'll provide you with a discharge plan, which will include instructions on how to take your medications, how to care for your rash, and how to prevent the spread of the virus to others. We'll also provide you with a follow-up appointment with your primary care physician in a week, as I mentioned earlier. Please take rest and avoid strenuous activity until the rash had healed.
Thank you for your help, Dr. Jones.
You're welcome, Valentina. If you have any further questions or concerns, please don't hesitate to ask.